we'd love to hear just a little bit about you, where you work, what you do, what you're interested in, maybe how you hope to partake or collaborate with the OHDSI community, and if OHDSI can help you. We're gonna not necessarily do Q&A or have people comment afterwards. That can be done in the chat. Hopefully as many of you as possible have access to the chat. But this is a great way to just kind of learn about some of the new people. We'll just go all the way through. Some people probably registered and aren't here. That's fine. If we get to the end and other people want to raise their hand and introduce themselves, that would be great. But we want to make sure we get as many people as we can. So on that note, Olga, I see you on camera. If you can, when you introduce yourself, go on camera. That would be great. Obviously, not necessary, but it does make it a little better. Olga, do you want to start off?
Yes, sure. Thank you. So I'm Olga. I'm a physician by training, a researcher, manager. I work at the University Hospital of Bern, Switzerland, and I'm a head of Department Health Information Management and Product Line Manager in the Data Science Center. So literally we are responsible for the clinical data warehouse. We are hosting all data from our EHR records for use for medical decision support, research, and supporting observational studies in different settings. So we are part of the Swiss Personalized Health Network and develop a lot of semantic to support a rich data source we use for the research and interoperability and data exchange. So my research interests are obviously structured data, observation research, observation studies. So I'm interested in adverse outcomes such as surgical infections, sepsis, acute kidney injury. So we conduct a lot of studies, and so our approach is to generate evidence through data-driven diagnosis and support data-driven medical products and build our own data pipelines. Finally, using LLMs and machine learning to set up new use cases. We also built a knowledge graph for our patients' population. And last year, we implemented CDM model for our data cohort, and are happy to contribute to the OHDSI community. As Swiss, we are a bit isolated, so we are not part of EU, but I think maybe we can close the gap and become a part of the European research community. Thank you.
Great, thank you so much, Olga. This is also being recorded. We'll have this later, so if anybody wants to go back and hear a little bit more, but certainly reach out in the chat as well. Sam Fish.
Hello, I'm Sam Fish. I am an incoming PhD student at Columbia University's Mailman School of Public Health and Epidemiology. I'm also part of the Center for Pharmacoepidemiology and Health Outcomes Research. I currently am really interested in the pharmacoepi methods, and I also recently partook in the OHDSI summer session, so that was really fun, and I have a big idea of how OHDSI studies work, but I want to really get involved and hopefully partake in some. And so my research doesn't necessarily focus on a specific disease or drug, but more so just the design of the studies. So yeah, that's who I am. I would love to collaborate with anyone that is willing.
Great, thank you, Sam. And it's exciting to see somebody from the OHDSI Summer School jumping right in. So that's a very positive sign. Gaurav?
Yep. What's up? I'm Gaurav Dravida. I work at EPAM Odysseus. We got acquired probably in January. Last year I did ETL conversions for working as more of an analyst, and then this year I'm doing a little bit of the BI aspect, research on economic weak points, advising on ETL conversions. Last year I wasn't totally involved in the OHDSI community. I was able to go to the OHDSI symposium. A lot of it did go over my head, but it was kind of like my first taste of what this community is and what we're trying to, I guess, the goal that we're trying to go towards. This year I'm definitely trying to be a little bit more involved in the Odyssey community. I actually want to start a work group, technically restart a work group. I don't know if you guys remember Hiva. Gautam started it in 2018. It's called Health Economics and Value Assessment. But we will be restarting that. So if you're interested, I mean, we will be talking about it on August 26th at that call. Yeah, I mean, would love if like you guys are want to be a part of that. That'd be great.
Great. Thank you, Gaurav. Yes, again, the part of the community updates right after Gaurav will talk a little bit more about this work group. But thank you for joining, introducing yourself. Pranav? I don't see. All right, we'll kind of just keep track of people who don't show up. Maybe they'll show up later. Mustafa? Oh. You go Chakwu? All right, let's just see who breaks this first. Osmin? I see you.
Hi everyone. Do you hear me?
Yes, I do.
Oh, thank you. Okay, my name is Usman Diop. I am from Senegal in West Africa, and I am a data science manager at the Institute for Health Research, Epidemiological Surveillance and Training, called it RSF. Founded by the Professor Suleiman Bouk, we discovered HIV-2. And I am working for 4 years on several research projects. And I have a background in computer science and data science. And throughout the EPSHRC Data Science Without Border project, I learning OHDSI ecosystem. And currently, I already have opportunity to standardize the COVID-19 data set. And currently, I'm working also in another data set from my institution. I'm building also a no-code tools to translate French data and pre-map it to OMAP vocabulary. And I think there is a follow-up section maybe next week. I will be happy to do a short live demo of the prototype of this solution. And I'm also passionate about innovation, startup, interoperability for African data, multilingual concept mapping, and also data quality. Also, I'm passionate about machine learning for climate-sensitive disease like malaria and dengue. And I hope to contribute to West Africa vocabulary mapping, reusable tooling, and onboarding support for new site. And from OHDSI, I'm seeking mentorship on vocabulary extension, DQD best practice, and improve my writing skills because I'm more comfortable with technical things, and collaborator for network studies, So glad to see you all again. Thanks.
Great, thank you. I'm realizing I skipped Natalie. I didn't see her, but Natalie. Okay, and I'm also doing this as people put their name, how people put their names in the form. So, Hung. All right. Yeah, Abdian or?
Hello, everyone. Do you hear me?
Yes.
Okay. Hello, everyone. My name is Somaya Abedian, PhD in IT management with a background in software engineering. I'm a senior researcher at the Ludwig Boltzmann Institute in Digital Health and Prevention in Salzburg City, Austria, and an adjunct faculty member at the University of Toronto as well. I have over 17 years of experience in the field of electronic health record standards and serve as a representative of both Iran, my country, and Austria as well in the ISO Technical Committee 215 Health Informatics Committee. My expertise is in the health interoperability standards with a focus on semantic mapping and harmonizing data across standards such as OpenHR, FHIR, and OMOP Common Data Model. I also work on integrating patient-generated health data from wearable devices and mobile applications into research environments, and I'm interested in how actually AI tools can improve ETL process and terminology mapping. Currently, I'm working with a group of experts in Austria to establish a national OHDSI node to further support data standardization in health research. So if you are in Austria, please get in touch with me. I'm also involved in projects using OMOP for the secondary use of health data, such as the European IDRA project, which focuses on data standardization, harmonization, and interoperability. Actually, I joined OHDSI because I believe this community offers a unique platform for sharing experience and collaborating on large-scale international projects. I think it's a best place to share and for networking based on e-health projects, actually. In addition, maybe for last points, I'm currently a part of OpenEHR Fellowship, and I'm honored to be among the 10 selected participants in the program's first ever cohort. And thank you very much for this opportunity. I look forward to networking and future collaboration. I will share my LinkedIn page in the chat, and I will be happy for networking with the experts. Thank you.
Great. Thank you, Samaya. Yeah, anybody who wants to share any links in the chat, please feel free to do so. And I will highlight, as I mentioned before, we had all the upcoming calls. The call after the symposium is really it's for everybody, but people who are kind of just jump in, we do a welcome to OHDSI call where it really kind of highlights how the whole community works, both scientifically and collaboratively, and how to kind of go through the website, Teams, everything you need to know. So for a lot of people, that's a call that if you can make, that is a really useful one. So again, thank you, Samaya. Next one, Ashley.
Thank you.
Yeah. Ashley Marte. Okay. Lucia. Jiwoo.
Hi.
Here. Yep. I hear you.
Can you hear me?
I can hear you. Yes.
Okay. So, sorry. Is my camera on?
It's like it's trying to go on, but it's not on yet. Now I lost you.
Okay, so maybe there's some so I will just start with my voice because I cannot turn on my camera. So yeah, hi, I'm a new incoming PhD student in the School of Information at Florida State University. I'm from South Korea, but my supervisor, Dr. Zuri, recommended this community to me because I have a background in ontology from my master's studies, and I have been particularly interested in biomedical ontology. So I'm excited to learn from this community and contribute to this community. Thank you.
Great. Thank you so much. And good luck in your program at Florida State. Jill Vestal. Okay. Oh, no, I wrote Ashley twice. Ozioma. Daniel. Vinay.
Yeah, hi. Can you hear me?
I can.
Yeah. Hi, I'm Vinay Pai. I'm the Chief Technology Officer at Health Equity, which is a Berkeley, California startup focused on digital care coordination and remote patient monitoring through its Activate platform and the mobile app that goes with it. We are primarily based in the US. We focused on improving outcomes for underserved populations. We did a proof of concept study with rural and family farming communities in California. And we primarily work with federally qualified health centers and are currently deployed in California and Hawaii. My background is PhD in mechanical engineering. I used to be at the FDA till pretty recent. I was a member of the Digital Health Center of Excellence there. And prior to that, I led the formation of a division of health informatics at one of the National Institutes of Health. So I've been following OHDSI for quite a while, silent contributor, I guess. And so my focus has been on health and biomedical imaging informatics over the last 25 years. Some of the work that we're doing right now at Health Equity are around developing digital twins for different disease and chronic conditions, especially and for women's health. And we are also building AI tools for voice to text and text to voice language translations in non-common languages. So it'd be great if you can collaborate on some of those kind of activities. So we're also deploying in Germany and India, and it'd be nice to connect with those communities, figure out a way we can bring some of the data into the common platform where people can work with it, obviously de-identify data sets. I can put in my information in the LinkedIn, so that should be useful for connecting. Thank you.
Great. Thank you, Vinay. Next up, Kayoko.
Yes, thank you so much. Can you hear me?
I can.
Yes, great. Thank you so much. Thank you for the opportunity to introduce myself. My name is Kayoko Shioda. I'm an assistant professor of global health at Boston University. And my research focuses on vaccine epidemiology and evaluation using observational data and target trial emulation or other causal inference techniques. And I actually had a chance to do a very quick presentation about my ongoing research using OHDSI data, maybe in the spring. But with Dr. Fan Bu, who is also on this call, she's from the University of Michigan, we have been using the OHDSI data to understand the optimal vaccine dosing schedules, which is defined by the number of doses and the timing of each dose. My research focuses on these kinds of things for vaccines. And OHDSI data has been such an important part of the research. So I'm very excited to keep being involved in the OHDSI community and learning more about the data. And I'm very happy to contribute to any research on vaccine evaluation and causal inference techniques or target triangulation. I do these things a lot for infectious disease outcomes. So I would love to talk more about these things with the OHDSI community members. So thank you so much for the opportunity.
Great. Thank you, Kayoko. Certainly a good person to work with, Fan Bu. She is one of the Titan Award winners, I believe, 2 or 3 years ago. So a terrific person to work with. And while I'm thinking about it, because you hear different interests throughout, everybody should really check out our work groups page, which you can find on the OHDSI website. There are so many different work groups that focus on different clinical applications or methods or data, and you can really find focused communities within the greater OHDSI community. So I would invite everybody at some point to check that page out, and you can join them very easily. Next up, Christian.
Yes, thank you. Christian Hogberg from Sweden. Well, I'm engaged now in OHDSI to try to put Sweden on the OHDSI map. Sweden has not, we've had some early adopters, but it has been growing a little bit organically, and the bigger ecosystem of players has not actually been aware of OMOP. So the past year I've tried to mobilize attention and interest in OMOP in Sweden. I've formed a consortium of now 11 organizations, and we recently got some funding. So actually tomorrow we're starting a national initiative called OMOP for Sweden, in which we are going to try to improve the circumstances for adopting OMOP in Sweden. The goal is to, in the next 3-4 years, to really harmonize a lot of data sources in Sweden and get this thing going in this country. We have a wealth of health data. We have excellent scientists and analytical people. So I hope that we down the road will make a huge contribution to the world of health data. Thank you.
Great. Thank you, Christian. Last month at the Europe Symposium, we heard about the great work and the spread of OHDSI throughout Europe, but there are a lot of countries that still are yet to join, and it's great to hear people like yourself trying to help grow OHDSI throughout Europe. Farnoosh, didn't see that name. Kyungsun. Okay. Adil. Delaney. Yeah, I was definitely afraid we were going to run over time, but it doesn't seem like it'll be a problem. Francis? Charlotte? Craig Rothenberg? Yeah, I see
Hi,
you.
can you hear me?
Yes, I can.
Hi, I'm Craig Rothenberg. I'm a statistician at Yale School of Medicine and with Yale New Haven Hospital. So I do a lot of research in practice changes in the emergency department, things like quality improvement measures, interventions, CMS metrics, a bunch of stuff like that. So our organization is kind of working to help our researchers get access to the OMOP Common Data Model instead of the approach we've used in the past, where we've pulled data from EHR, from Epic Caboodle's data source. So we're kind of in the process of doing that right now. And one of the challenges we're getting in emergency medicine is that in our system, at least, some of the variables that are important to us haven't been mapped in a way that we can use. So a lot of things like timestamps, disposition things that are really specific to emergency medicine that might not appear in other systems. So we're kind of hoping to get an idea if anyone has experience with emergency medicine variables, or just how others have approached getting data put into OMOP that really maybe hasn't been mapped yet, or maybe is mapped in a way that just really to just get more information about the best approach to that. Thank you.
Great. Thank you, Craig. We have one more name on the list, and I see Saba on the screen. But before I call, if we certainly will have time, so if there are other people who would like to introduce yourselves, maybe just raise your hand, and then I will go through the chat afterwards. So, Saba?
Of course. Good morning or good afternoon, everyone. My name is Saba, and I am currently a PhD student at the University of California, Irvine, in epidemiology and biostatistics. There, I have a focus in cancer epidemiology, and I'm also a co-op at Johnson & Johnson right now for the fall. So I'll be here until about December. I just recently learned about OHDSI, and I've already started to work on 2 projects using the CDM. So it's been really exciting to kind of understand how streamlined the workflow can really be, and when we have standardized vocabulary. I'm just here to learn, and so whatever opportunity I have to do that, I will continue to engage. Thank you so much.
That's great, Saba. Thank you. Okay, Stefano.
Oh, hey, everybody. Sorry for not submitting my name earlier. I'm a database coordinator at the Karolinska Institute in Stockholm in Sweden. And I'm working on a harmonization project for cancer data. And I attended that European OHDSI Consortium at the meeting at the beginning of July. And now I'm playing a bit with the OMOP standard to see how to use it for data harmonization. Because as Christian mentioned before, Sweden is relatively new to all this. There are not so many implementation stories there. So we are trying to build infrastructure and teams from scratch. So happy to be here.
Great. Thank you, Stefano. Chris?
Hi there, I'm Chris. I work for the NHS in England, and I'm not in a research role, but trying to basically improve the standard of analytics in the service and move away from purely performance management into a more evidence-based approach to commissioning health services. I think particularly interested in trying to get mechanisms to evaluate more robustly whether the sort of national policy directives that come from the government are really effective in managing demand and utilisation of healthcare. Particular interest at the moment around rapid response community interventions, models for delivery of healthcare to homeless patients, and same-day access to primary care physicians. But yeah, it will be a big learning curve for me to engage meaningfully in this group. To be honest, it's very much a learning curve and sort of part of my development, and hoping to find some things that I can bring back into the service that we do.
Great, thank you, Chris. Certainly, it's a big learning curve for almost everybody as they start. So you're certainly you're not alone in that. Isaac.
Hi, thanks. It's nice to meet you. I'm Isaac Michaels. I'm a data scientist at New York Presbyterian Hospital. And I also just finished my Doctor of Public Health degree at the University of Albany with a concentration in epidemiology. At New York Presbyterian, we're focused on quality. My group is focused on quality and patient safety issues, and also evaluating interventions. I wasn't aware of OHDSI until recently when I took, at the recommendation of some colleagues, a summer school program for 1 week at Columbia University in OHDSI, and I was very inspired and excited. So it's really great to meet everyone, and I can't wait to collaborate further. Thanks.
Great. Thank you, Isaac. Celine?
Hi, everyone. Sorry, I am an assistant professor at Emory University Biomedical Informatics Department. And my research areas I'm also affiliated with Palliative Care Department, Winship Cancer Institute, and Ethics Center here. High level, my research is mostly focusing on cancer, advanced cancer, and using electronic health records data to understand patient-reported outcomes and how they affect many different clinical outcomes. I do lots of NLP work as well using EHR. So that's why a common data model like OMAP is very important for me for cohort selection, designing the variables, and many aspects of my research. I was lucky to use OMAP data, some scattered pattern before at Stanford and VA because they has a transition. But Emory just started to transforming this process, and I want to learn the big picture better and details better. So I'm happy to be involved more. Nice to meet you, everyone.
Great, thank you. Nice to meet you. Farnish.
Do you hear me?
Yes, I do.
Oh, perfect. Because my mic was not working, so I had to change some stuff. Okay, perfect. Yeah. So I'm Farnush. I'm part of STAR team at Stanford. Priya Desai is an active member on OHDSI. I joined the team last year. I've been following OHDSI for the entire year. We've been extremely busy bringing some oncology data in. And then recently I've been working with Stephanie and Allison to create pregnancy episodes. So as of now, we are thinking of use the episode data, an episode table in OMAP to bring episodes, pregnancy episode, and later on perhaps oncology episodes. Overall, my background is I have over a decade of running biostats. I've been part of the School of Medicine in the past and Quest Diagnostics. And recently, I've been doing a lot of data engineering some packages to scan OMAP. So I thought I'd just introduce myself because I think this year I'm going to be a lot more involved with the community and try to do lots of fun and exciting stuff. Yep.
Great, Farnish. Thank you. It is great to see. I mean, you really do see people. There are people certainly that are new and they spend their first year learning, and that's great. But there are people that jump right in and make immediate impact. So it's great to have basically everybody who's new. Shika.
Hi. So I guess that I'm on Farnoosh's team at Stanford, actually. We both work under Priya Desai. And so once again, I'm also working on oncology data, bringing that into OMOP as well. And actually, my first introduction to Odyssey was not through my role at Stanford, which I just joined last year in September, but I actually joined some of and a lot of the initial online calls even back in like 2019 when I was a master's student at UC Davis. And I actually did my master's thesis using UC Courts, which was a OMOP subset of the UC Health OMOP of the 5 UC Health systems. So that was my first introduction to OMOP, and just kind of excited to further my OMOP work with Stanford at the moment. Been trying to be involved in a few work groups as much as possible. I think it's just early morning stuff, but I'm really excited to keep being involved, and hopefully I can be at the symposium this year too.
That would be great, Shika. Thank you for joining. Allison.
Hi guys. It's lovely to meet everybody. First of all, thanks for having me. I'm at the University of Limerick and I'm an assistant professor in health-related data analytics. So I do quite a lot of computer science-based health research. So the scope is huge. Sometimes it's like hardcore machine learning, sometimes it's natural language processing, and sometimes it's much more like policy-based kind of thematic analysis of health data. I was particularly interested to hear Craig talking about emergency medicine and daytime issues, because I have come across really similar challenges here in Ireland, where we don't tend to have a national electronic healthcare record. In fact, you're lucky if you get any electronic healthcare records at all. And when you do get them, they're generally a mess. So like many of you, I don't have, I'm still getting to grasp with Odyssey as like a community and OMAP system and how it works, but I'm very excited to learn more. And I've been a silent stalker for a few months now, but I'm pushing myself to get more involved. So yeah, and I'll also put my LinkedIn details in the chat later. So if any of you want to connect, I'd really love to talk to anybody from the wider community. Thank you.
Great, Allison. Thank you so much. I'm glad you put yourself out there. I'm glad everybody who joined today did so. Are there anybody else want to introduce yourselves? I haven't seen any other hands. One thing I find most inspiring about this community is not only just the wide range of research interests, but the geographies, the breadth of people who have joined this call alone from all around the world with different interests, but the same ultimate goal, which is the goal of our community. So I have another name, Mwanga.
Yes. Hi. Hello. My name is Mwanga Khalifan. I am from Uganda. Work with IDI, an African Center of Excellency on antimicrobial data. And mostly we build data warehouses containing data, HIV data, and AMR data. And right now we are currently trying to embark on building a lake house, and I want to. One of my interests is seeing how how this could help me with that as well. Yeah.
Great, thank you. Welcome from Uganda, which will be the site of the upcoming Africa Symposium. Anybody else? Okay, great. Well, first of all, thank you again to everybody who joined. It's such an important thing to just introduce yourself, have people here. Well, as I mentioned before, this will be recorded, as are all community calls. So if you ever miss an interesting topic that you want to hear about, please visit the website, go to the community calls page or our YouTube page that has all of these recordings. Since we do have a little time, I'm wondering if there's any of the more veteran members of the community that have any thoughts or comments or just suggestions of ways to kind of your first steps in the community, how to become a little bit more involved, because that's what I'm hearing is that people want to really become, collaborators in the community. Erica, go ahead.
Yeah, well, I want to say a couple of people said they were just stalkers, and I think that's fine. It's fine to come and like try to understand what are all the different components. But Craig talked about like our work groups, and if there's a work group that you think you're interested, just go to the meeting and stalk that for a little bit. And there's always little pieces that you could break off and try to do, like to start getting involved. And so don't be afraid, like you don't have to come in and be the primary programmer or the primary researcher. There are lots of components to all the work groups that you can get started and have a big impact just by participating. So basically, stalking's okay. That's a great way to get started.
In this case, stalking is okay. I'm just gonna, while I share, and anybody else has thoughts, but this is our work groups page, and you can see just how many work groups, how many these videos are the latest kind of OKRs or objectives and key results. And you can see there's just such a wide range of work groups that people can join. And as Erica said, just stalk and listen, or immediately kind of add to the work going on. So please do check it out. Anybody else have any thoughts? No need to raise your hand. Somebody can just unmute and talk.
Hey, Craig, I'll just say one thing. I'm really excited by today's call to see all of the newcomers from all around the world. It really warms my heart to see everybody having the courage to stand up and talk. And also, for those of you who feel like you're being vulnerable by saying you got a learning curve and it's a big journey ahead, all of us started at the same point, and most of us don't bite too hard. And so we're here to help and support you in your journey to be part of this community. The one thing that we frequently hear is that it's overwhelming to try to understand everything in Odyssey. And part of the reason we created this community is because we don't believe that it's even possible for any one person or one group to be able to do all the things necessary to generate reliable evidence. And so, echoing what Erica said, I think finding an area where you want to start digging in a little bit deeper is a good thing. You are absolutely welcome and encouraged to kind of experiment and jump around, and some things may be your area of interest and some things may not, and that's totally okay. Our standard rule for all of our work group activities is actually just if we see somebody's new on the call, just ask them to introduce themselves and get involved. And you'll find that there'll be lots of folks that have been part of the community that are here to try to support you in your journey and looking for those collaborations. And it's something that we've been putting a lot of effort towards is how do we actually sustain a collegial international community network of friends and colleagues to support each other in a shared interest towards advancing public health. And so I'm really excited to see all of the newcomers who've come on today to comment about their interests, and really looking forward to seeing you all become active participants in our community.
Thank you, Patrick. I'm highlighting because there were, not everybody, but there were a number of people who really were kind of junior researchers. We do have an early stage researchers work group, which is meant to bring together people who are really starting their research career. This had been going for 2 or 3 years, and the people who were leading it moved on in their careers, and now we have 3 really great people who are kind of at this stage and took this over the last 4 to 6 months maybe. So this is another great work group you can join. If you are interested, up here at the top, well, you can see join a work group. Also under here on the work groups, join a work group. It's literally just a form. You check any box you want, and we get you to that Teams environment where most of the work group communications, meetings, all of that happens. Anybody else want to share anything before we cut this?
I can say something for all
Great,
the
Elsa.
newcomers.
especially the more junior folks on their journey of science and their students or just finished or started a program, as you join the working group and start talking to your OHDSI colleagues, trust me, everybody is equally nervous when they talk to somebody new of how they want to impress you to stay on the journey. It's both sides. Don't think that you're going to say something that is not smart or show that you don't know much. No matter how much we know on OHDSI, we're also always nervous when you talk to new people because like I really want to impress you and I really want you to stay. So I'm like so scared to say something that might scare you or might not make sense to you or might be relevant to you. So it's both sides, and really magic happens when we just start thinking together and collaborating together and solving problems. There's so many problems, and we always try to do things better. So any brains, any hands, any thoughts are always welcome, and you're gonna make a difference no matter how small or big.
Very well said, Azza. This really is the most supportive community I've ever been around, or so I can say it goes, and it does go both ways. Christian.
Yes, thank you. Well, I must say, I started working about 30 years ago. I worked on something called knowledge management, and we had this community of practice and communities of interest was one method to drive knowledge sharing and knowledge creation, and coming into the OHDSI community and starting to be part of it. It's really, what we talked about 30 years ago, what would be a good example of community of practice and of value creation and knowledge sharing and collaboration and problem solving. And I see what you guys have done. And I must say it's truly impressive. And I'm very grateful to have this opportunity now to leverage this tremendous work that has been done over the years, to bring that to Sweden in a larger extent. Hopefully we can really, adopt this now and leverage all the work that has been done, but then also with time, give back, so that we, with our science, with our brains, with our energy, with our efforts and with our data, hopefully, 4 years from now or 3 years from now or 5 years from now, we can all stand here and say, Sweden is now on board, we're part of this. And I just say, great work, everyone that has contributed to the work of OHDSI, a tremendous work.
Thank you, Christian. And it's true. OHDSI is slightly over 10 years old. So you think about kind of how much has happened in the community, and it has been and it will be people like yourself who join whenever they join and take some of the work that's already been done and then build on it and spread it and bring it to new areas and help it grow. So where we are in 20 years, will be part of the work that you have done, and everybody who has joined this call hopefully will have done to keep moving OHDSI forward. Any other thoughts? Great. Well, I want to thank again everybody who joined and introduced themselves. Please continue to join these calls. Check out the OHDSI forums, check out the website, stay in teams, join work groups, whatever it takes. Reach out to people because, like I said, I really want to get the mentorship, the support, the collaboration, the spirit of collaboration in this community is second to none. So if you have questions, reach out, ask people. If they don't know, they'll tell you who to get to. And we hope you continue to join and grow with us in our community.